Hi everybody. Today I'm going to talk about lymphatic cording, and before I begin, just please like and subscribe. I'm also going to be doing a hiking series this summer that's going to be kind of special. So if you want to catch that, then go ahead and subscribe to my channel. And I also want to do a disclaimer today as I talk about cording. I want you to know that I am not a medical doctor of any kind. So don't watch these videos thinking that I'm giving you advice on what to do. I'm not. I'm merely going to explain it today and some of the patient experience that I have had with it, as I have been in physical therapy for almost 6 months now because of lymphatic cording. So, first of all, what is it? Lymphatic cording is also known as axillary web syndrome, and it's like 30% of breast cancer patients who have had lymph nodes removed get some form of cording. Now, it's a lot of times it's very visible under the skin. Sometimes it's not. Mine isn't as visible. I have some you can really see if you pull on them, but I don't think I have it as bad as some women do. But basically what it is, your body is arranged, your lymphatic system is arranged in quadrants. So if you split your face right down the middle and to about the bottom of the rib cage-ish, each side has its own set of lymph nodes, and then if you go below that, split in the middle, you have one for like each leg, hip and leg area. So these quadrants are, the lymph nodes are located underneath the arm. And they think, although they don't really know for sure, what happens when you have lymph nodes removed is that some of those lymphatic cords that they run all down, they pump lymph fluid to fight infection all through your body. And they're really, really tiny, and there's like thousands of them, and they're all over. So essentially what happens, they think, is that they get kind of bunged up in scar tissue, and they become visible on the skin surface, and they become very taut. They actually look kind of like guitar strings that are pulled snug underneath the skin. And they can cause mobility issues. They're actually, if it's supposed to be down here, they kind of contract. And, they can cause issues with like bending the elbow out all the way. And my issues were with lifting my arm. My mobility in my arm was limited. You can kind of see mine right there. Somewhat. If I really pull, I've got a nice big one. I don't know if you can see it on camera, but it runs up through here and up my arm. I can feel it in my joint. I'm not sure you can see it. I actually am starting to get better too. So I've been in physical therapy for a while, since December, at least early December. But that's essentially what they're going to do. So after surgery, that can happen, and it's not uncommon. It can be down here. I have 2 of them, actually, that run. I have one, like, right in here, and then I have another one down here. This one actually runs across my rib cage. And I have a few up in here as well. And really, that's what it is. The physical therapist is going to do massage. She does, like, mine's a lymphedema specialist. Lymphedema is a completely separate thing from cording, but generally a lymphedema specialist deals with breast cancer patients, and she has more of a handle on their special needs after surgery. So that's in general, I think, where most people would go. And she basically is going to just continue to stretch those cords put pressure on them, try to get them to release and also massage the scar tissue and get the scar tissue to kind of basically let them go. There are some stretches you can do at home for them as well. And I have, in the last month or so, I started doing some gentle yoga stretching, and I will post a link for her. She's wonderful on YouTube, and I've been doing her videos now at least 4 to 6 weeks, and my mobility has definitely improved. So I don't think with the first initial diagnosis of cording you should start yoga right away, but work with your personal doctor and therapist, and as your mobility increases, I think the yoga is a huge help. Nothing too aggressive, but doing like the gentle, like bedtime stretches and office stretches and things, they've been really helpful for me. So basically that's what it is. And hopefully you don't have it. Hopefully you have good luck. Not like me. And I will check in with everybody later. Thanks for watching.